Good afternoon, everyone. Thanks for being here. Today we'll be providing an update on our voluntary family and medical leave program, which launched in December of 2022, first to state employees, then to employers and to individuals not already covered. The voluntary approach was important as a balanced way to provide paid leave for those who need it, with taxpayers' ability to pay for it, which is especially true as we see federal COVID money coming to an end and costs rising in other areas. And with the affordability crisis we continue to face, an opt-in approach allows flexibility for those who don't need it or want the coverage, while allowing those who do with options for both employers and individuals. Since implementing this program, which is still in its early stages, we've seen employers and individuals from across the state enroll and take advantage of the benefit with positive feedback. We're joined today by Zach from Deep Analytics, which is an employer right here in Montpelier that's enrolled in the plan, and he'll talk more about his experience. With employers continuing to struggle to find workers they desperately need, this benefit gives them a competitive edge, especially in a tight labor market. As we know, we're faced with many challenges: education, housing, affordability, and public safety. And with each of these challenges comes a need for more workers, resulting in more taxpayers in the state, which will help reduce the tax burden. I want to thank the Hartford for joining us here today and for their continued partnership to bring family and medical leave insurance to Vermont. So with that, I'll turn it over to Kim.
Hi, everybody. My name is Kim Rudine, and I lead the Hartford's Absence Management Group. I'd like to thank Governor Scott and Commissioner Smith and others in the state for their partnership in developing and rolling out a program that brings the valuable benefits of paid leave to Vermonters. I also want to thank Zach Clements from Deep Analytics for agreeing to be here today to share the story of how paid leave has helped their workers and their families. The state of Vermont, Deep Analytics, and the Hartford have convened today to share a key message. We are seeing positive numbers from Vermont's paid leave program given the early stages of its rollout. We're pleased to highlight this positive trend and urge more Vermonters to consider enrolling in paid leave, given the assurance it provides to employees who require time away from work for family or health-related reasons. To start, I'd like to tell you a little bit about the Hartford. We're founded in 1810, and we are a leader in employee benefits, including leave management and paid family and medical leave programs, as well as personal and business insurance and mutual funds. We are the #1 provider of fully insured disability insurance in the U.S., so we see every day how these types of income protection programs help employers support their workers during life's most critical moments. We were honored to have been selected as the insurance partner for Vermont Family Medical Leave Insurance Program in 2022. Since that time, we've worked closely with the state to roll out a thoughtfully designed program, which has been supported by targeted education and marketing initiatives designed to communicate the benefits of paid family and medical leave insurance. While it is still in the early phases, we're very pleased with the response to the program to date. We're seeing encouraging levels of participation, and what stands out is the uptake of paid leave in Vermont is tracking in line with other states' experience when they rolled out similar benefits. We're hoping that more employers and workers become aware of the program, and we expect our numbers to keep growing. We look forward to seeing even more Vermonters sign up for this very important coverage. It's important to remember that employees are the heart of every business, and their productivity requires workplace flexibility to manage personal and family needs. The paid leave that is offered through this program helps reduce financial stress, allowing individuals to focus on recovery or caregiving. For employers like the one here today, offering paid leave can enhance engagement, increase retention, and promote overall workforce well-being. Vermont's paid leave program offers partial income replacement for employees who need time away from work to care for a family member with a serious health condition, bond with a new child, manage their own serious health condition, or address needs related to military service. The program is flexible and allows employers to design a plan that meets the unique needs of their workforce. Key features of the program include options for combined or standalone family leave insurance. This means that employers can elect to provide a program that includes either both medical leave and family leave, which includes that coverage for the employee's own condition and the family care, or they can decide to provide a program only for family leave. Flexible contribution models that can be employer paid, employee paid, or shared also exist, and benefit durations that range from 6 to 26 weeks per year, and wage replacements can be between 60 and 70% with additional options available. Again, we are so pleased to be able to bring paid leave to Vermonters. The Hartford has the technology, expertise, and dedicated staff to ensure a seamless experience for employers and employees alike. We look forward to continuing our partnership with the state and expanding awareness of these essential benefits. Employers and individuals can learn more or enroll by visiting fmli.thehartford.com. Thank you very much, and now I'm going to turn it over to Zach Clement from Deep Analytics.
Thank you. Hi everyone, my name is Zach Clements. I'm the Vice President of Deep Analytics. We're a small research and development business, currently about 12 full-time scientists and engineers, and we're located right up the College Green, right here in Montpelier. We specialize in developing customized machine learning, AI, and sensor solutions, largely for the federal government. I'll offer what I hope is sort of an interesting perspective. Almost a year ago in September, my second child, Ellis, was born. Months prior to that, I was working with DA's owners, Greg Hewitt and Phil Stimmick, to determine how I was going to manage some amount of leave to be with my family. This is a tough calculus for a small company that largely sells our employees' expertise and labor hours. By happenstance, this was almost exactly when voluntary purchase of FMLI became available for private companies. At the same time, DA was in the process of nearly doubling our headcount. We decided that FMLI would not only support my leave, but would be an additional benefit to offer DA's employees as we continue to grow. My year of eligibility is coming to a close next week, and I can say that from both a personal and a business operations perspective, FMLI has provided an enormous benefit. Personally, because I was able to collect partial wages when utilizing the benefit, I felt less financial pressure to be at work when I needed to be at home than I otherwise would have if unpaid time or personal leave were my only options. As a small business, our monthly premium is very reasonable, and we're able to support our employees and keep them paid through qualifying events without bearing an unworkable cost as a business. I believe it's a comfort for our team to know that we offer this coverage, and it's a benefit that we're able to market when hiring. Thanks. I will turn it over to Kendall Smith, Department of Labor. Thank you.
Thank you, Zach. That's an amazing testimonial to how this program is supposed to work. So I'm glad you're able to share it. Good afternoon, everybody. My name's Kendall Smith. I'm the Interim Commissioner at the Vermont Department of Labor. And while a lot of what I was going to say has been said already, I do think some of it is worth repeating. And I want to take a moment to talk about what family and medical leave insurance means both for our workforce and our economy here in Vermont. So like Zach, at some point nearly every worker will need time away from their job, whether to care for a newborn, like Kim shared the qualifying event list, support a family member facing a serious health challenge, or recover from their own illness. And what's important for us all to remember is these are not unusual circumstances. This is part of being human. Today's workers expect more than a paycheck. They expect employers to demonstrate an authentic commitment to their well-being and economic security. Across the nation, quality indicators of jobs include fair wages, predictable schedules, comprehensive benefits, and paid time off. However, the reality is here in Vermont and elsewhere that not every employer can provide all of these things and remain viable, which is why our FMLI program is such an important resource for both employers and for workers. The availability of this insurance allows employers to retain employees and for employees to maintain an income during periods when they cannot work. And for our state, this program sends a clear signal. Vermont is a place where we care for each other and where work and family can go hand in hand. With this approach to paid time off, balancing access without a broad-based tax, we are creating conditions for Vermonters to thrive at work, at home, and in their communities. I also feel like my paper here is bigger than where these microphones are. I apologize. It's one piece of a broader workforce strategy that also includes ample housing, a true cradle-through-career education and training system, and safe, vibrant communities that attract and retain residents. Here are a few numbers, because I'm the Vermont Department of Labor and we like our numbers and our data. The U.S. Census Bureau conducted a survey of Americans about reasons for not working. Two of the reasons cited by Vermonters in that survey included that 6,320 people said they needed to care for an elderly person. 22% of our population is over the age of 65. The Vermont population over 65 is up 10% in the last 3 years, and similar increases are projected to continue in the near term. These are our workers' parents and our family members who may need additional support as they age that will require time away from their work site. And 18,545 responded they are not working because they are sick or disabled themselves. And remember, this was a survey about why people are not currently in the labor force. There are certainly more people currently working today that need time for their own care. Vermont's population is at a record high, yet our labor force is smaller today than it was in 2009 by 8,000 people. This is due to our demographics, which you hear us talk about a lot. As employers compete for workers in a tight labor market, this program helps with retention, which is a more effective workforce development strategy than recruitment. The Vermont Department of Labor is promoting this program and product to our employees and employers when we interact with them, and we are pleased to have this as a tool in our toolbox in terms of promoting healthy workplaces. Thank you, and I will turn it back over to the governor.
Thank you, Commissioner Smith. We'll open up to questions.
And if we could stay on topic first, while we have the Hartford folks here, that way if there are questions they need to answer, we'll have them here for that.
So why is the Hartford plan better than the legislature's more, they would say, universal comprehensive plan?
Well, obviously, this is a voluntary program, and it gives us an opportunity to try this out and see where the needs are. We're going to be struggling, I think, financially, budgetary concerns throughout the next few years as some of the federal money dries up. So I think that will put additional pressure. If we've gone with the legislative plan, it would put too much pressure on our already stressed budgets.
Would a universal plan be more of a draw for the workforce and for people moving here, as opposed to just being specific for each individual employer, whether they do or don't sign on? If there was a blanket plan, wouldn't that be more effective?
Well, I think this is competitive. I think that those who take advantage of it, those companies that take advantage of it, can use it as a tool to draw more people in. I want to stress, we've said this all along, a voluntary plan, I think, will work for us to test drive it. And in the future, that may evolve into something else. But at this point in time, it just makes sense for us to utilize what we have, a voluntary program that's been beneficial to many, to our state employees, as well as to some businesses. I think provides us with the metrics we need in the future.
Perhaps for Commissioner Smith, are there any numbers you could share about how many businesses have enrolled or how many state employees have taken advantage of FMLI?
So I'm kind of actually laughing because I thought you were going to ask me how many businesses currently have paid time off plans, and we've tried to survey and gather that information in multiple ways, but I don't have a number I'm confident in saying. In terms of how many businesses have enrolled, I would defer to the Hartford, and in terms of our state employee population and their experience, I'd defer to Commissioner Fastiggi.
Yeah, so the Hartford has, sorry. Thank you. Yeah, so we have over 10,000 Vermonters that are covered under the program. So phase one is the state governed employees. And then phase two, we have 63 employer groups that represent around 1,800 employees. And then phase three, the individual population is 67 individuals so far signed up just this May.
In terms of communicating this to employees, how do businesses make sure that employees know about this and that they're briefed on the benefits that are available to them?
Is that something you can answer?
I can help with that, absolutely. Yeah. So we've partnered very closely with the state to help provide educational materials and marketing campaigns, really to increase the awareness and the education. A common topic we kind of spend a lot of time on as an insurance carrier is that employees don't always understand benefits. So there's a process to educate employers and employees, and we leverage our brand and our marketing presence and capabilities in order to be able to provide that education and marketing support to help drive the goals for the state.
Yeah. Kendall Smith, and if I could just add on, you could think of it like as you're hired and your new employer is going through the different benefits they offer. So here's how you sign up for health care, use this form. Here's how you sign off for your 401k, use this form. This would likely at that point in time be when the employer says, and if you want to take advantage of FMLI, we offer it. Here's the cost share, et cetera, et cetera. Here's how you sign up. Or if they're not offering it, they may advertise, but you can sign up for this individually, again, through the Hartford.
We have an easy-to-use website too, Kim. Do you want to tell them fmli.thehartford.com? Do you have it there?
Yeah, I'd referenced it before, but we do have a website set up that provides some educational videos, different tools. It is fmli.thehartford.com, and employees can learn about the program there. And then, if they don't have it through their employer already, they can choose to sign up during the open enrollment period, or they can even take the information to their employer. Thank you.
Do the state's largest employers like Fletcher Island and Global Foundries already have paid leave?
That I do not know.
Yeah, I wouldn't know. I don't have insight into specific employer, kind of paid leave approaches, but, many large employers will sometimes offer their own internal policies. Paid leave can take many forms, so.
All right, that's all for on topic. We'll switch to off topic now, and folks are.
Governor, have you heard back from the federal government regarding the sanctuary state letter that you sent last week? Saying that we're not a sanctuary state.
Right, no, have not heard anything back at this point.
Is there, maybe Secretary Samuelson or Secretary Saunders, if they're on, would be better to answer, but was hoping you could give a little bit more information about what this PrEP grant that the state heard the other day might be under threat, what exactly that does. Is that about programming in schools or programming outside of schools?
Yeah, I think we're still trying to figure that out, if I've got the right program. I think there are 46 other states that currently are impacted, and we're just trying to figure out what this really means. And I know it was, a few $100,000, so it's significant. But we're trying to figure that out as we speak. I don't know who else is on. Secretary Samuelson?
Yeah, no, Governor, you're absolutely right. The Department of Health did receive the notice from the federal government. We're trying to sort out what it means. Just to put some of the facts out there, the PrEP program does provide information for adolescents and youth, particularly around STIs, HIV prevention, and prevention of unintended pregnancies. It is not a school-based program, so it is not offered in the schools. Instead, it is offered in and among community organizations, so it's a completely voluntary program. And specifically, this program the specific notice has targeted a portion of the curriculum that was previously federally approved that would provide information and within that curriculum around gender and sexual identity, as well as consent. And that is at the core of the conversation with the 46 states, which I do want to point out shows how widely accepted this curriculum is. So those are the basic facts, and until we have an opportunity to really dig in to what their request is and evaluate it, as the governor said, we won't be able to provide much more information about it, but we are committed to continuing to provide education and support that really reflects the needs of all Vermonters, and that includes the GLBT and other communities.
Governor, a few years ago, I think it was in 21 or 2020, you put, I think it was $50 million in the state budget to build cell phone towers to try to connect people, and of course with public safety as well being part of that. Where do we ever stand with that? And do you just generally, when you think about cell coverage and how Vermonters are able to reach each other and reach authorities, how does that weigh on you nowadays?
Yeah, that was an initiative through the federal government, as I recall. And I think we're in the latter stages of that. Many cell towers have been installed. but there are a few more that have run into issues, with the communities and so forth about where to place the towers. So I don't believe the program is finished. Cell coverage in general, we've been trying to promote, as you might remember, it was probably 2 or 3 years ago, we put forth in our budget to the legislature a portion of that to expand cell coverage. But it was met with resistance from the legislature. It never did pass. So we still hear from folks who want more cell coverage in Vermont. But again, we were going to utilize some of the federal funding for that. And that didn't have much traction in the legislature.
I know the LURB nowadays is looking at sort of citizen appeals and Act 250 for like housing. Should like the PUC and folks that operate sort of in this universe take a look at whether people should be able to challenge these types of projects?
Well, I think there's a process in place. I think we've proven that with some of the challenges we've had in placing under that federal program. So I think it's working fine the way it is.
Governor, I did want to ask you about the disaster declaration request for the Northeast Kingdom. I wanted to ask, are there any updates on that at this time?
No, haven't heard anything back yet, and that's not unusual. It may take a bit. I remember, I think the last time, it was quite some time, like weeks before we heard back from the federal government. That was under the previous administration.
Is that request specifically for approval of public assistance, or is it also potentially individual assistance?
Not individual that I am aware of. It's just the public assistance.
And is that because of the scale of the damage?
Yeah, the scale of the damage. I don't think we met the requirement. Had we met that requirement, we probably would have made the ask.
All right, we'll switch over to the phones now. Tom Davis, Compass Vermont.
Thank you. Governor, at the city council meeting in Burlington, where they voted the new resolution for more enforcement in the City Hall Park, multiple people got up to speak at the open session, many of which calling on you to help out with the enforcement issues. I know you mentioned in a previous press conference that you had not heard from them. I was curious if you have heard from them since that vote, or if you expect to.
I mean, we've heard broadly through the press and otherwise that, they'd like some help from the state in some of their needs, some of their challenges. But I haven't heard anything specifically about law enforcement other than what I've read and heard from the council themselves. So I think they're moving in the right direction. That's an area that I think needs to be addressed. And again, we're going to be taking a look at this. I'm meeting with a business group in the next week or so as well. I'm going to be meeting with individuals that have some background in Burlington needs, and then we'll come up with a plan that we'll address with the mayor and see if there's any interest in working together on this.
Thank you. No other questions.
Keith Whitcomb, Rutland Herald.
Nothing at this time, thank you.
Thanks, Keith. Tim, Vermont Biz.
Nothing today, Amanda, thank you.
Thanks, Tim. Ed Barber, Newport Daily Express.
Yeah, good afternoon. Governor, could you or one of your cabinet members give a brief synopsis, if you will, of the difference between the Hartford plan and the state plan? Meaning, how many weeks of eligibility, what percentage of their paycheck is covered?
Hi, I'm Beth Fastiggi, Commissioner of Human Resources. So the state plan is the base plan, and it's 60% coverage for up to 6 weeks. Employers have flexibility where they can kind of buy up that coverage, so they could buy up to 70% wage replacement for their employees and up to 12 weeks of coverage. And the individual market mirrors the state employee coverage.
Thank you, Commissioner Fastiggi. It is worth noting, as has been said, that's the benefit of this voluntary plan, the flexibility. It kind of caters to the size of the organization, their needs, as well as their pocketbooks. So I think that's what's great about this, that Hartford is able to work with individual companies to get what they need out of this and at a price they can afford.
Governor, State
Okay, thank you.
Oh, sorry.
We'll go back to the room.
Oh, sorry. I'm jumping on. State representatives and senators in the Bennington, Manchester area are sharing news. I guess on Monday there was allegedly 2 women were arrested by ICE. I guess they're saying that they were home health aides in the community. Do you know anything about this incident?
I'm not aware of that, to be honest with you. I had not heard that.
Got it. Okay.
And just a question on Burlington. One proposed idea that I've heard about, which was used in 2022, was having state police officers patrol parts of the downtown in Burlington. Has any city official come to you maybe pitching this again or something like that?
That we have not heard in that regard. As a reminder, though, the City of Burlington did pay for that. So it was something that we offered and had volunteer troopers assist in that. And I would say that, we would contemplate that if that was something they needed.
And then, of course, with back to school, some school districts are implementing the new the day-long cell phone ban policy. What are your expectations on that? And to parents who may be concerned about this, what is your messaging to them?
Yeah, I think overall, I've been a big supporter of this change in policy, and I think it's going to be beneficial to the kids from an education standpoint. And if there are individual needs that they have, I would say you should talk to your school about that. But overall, I think this will be very successful, and we'll see the benefits of this in years to come.
What do you think it is that's most destructive about having cell phones in schools?
Distraction, not paying attention. I think that it can lead to all kinds of other things, bullying. I just think taking that out of the school curriculum atmosphere, I just think will level set and help focus on the work at hand, but also not get involved in some of the personal attacks from behind a cell phone.
Governor, there's another incident we've heard about. There were multiple letters sent to synagogues in Vermont and Maine making various threats to these organizations. Have you heard about, state police say that everyone is safe and that there's no backing behind them, but what messages do you have to Jewish Vermonters?
Yeah, we should not tolerate any anti-Semitism of any sort. So we obviously concerned on a larger scale throughout the country seeing this. I don't think we have experienced this at this point in time. It doesn't mean that it won't happen in the future. So we will react accordingly, but we should not tolerate it.
As we inch towards foliage season, are there any unique initiatives this year and what's been a tough tourism year to bring people to the state?
Yeah, in some respects it's been tough because of the Canadian market, but I think I reported last week that seeing the numbers from the state parks has given me some hope. I think we'll see some new visitors from throughout the region, in the Northeast in particular. It looks like it might be a great foliage season. I don't know if we have any bad ones, but this one might be even more spectacular due to maybe even the lack of rain. So we'll see what happens, but I'm hopeful because, again, the state parks data showed us that we turned it around and we're actually exceeding what we saw last year in terms of some of the visitation to the state parks.
Governor, on this Tuesday, the Lake Eden Association started a anti-milfoil herbicide program, and I gather there's been some local pushback against it. Have you heard anything about that? Has your administration heard anything about that, and how is that going?
I haven't personally heard that, but I'm sure somebody from the Agency of Natural Resources has, and I'll refer to Secretary Moore.
Sure, Governor. This is one of a handful of permits we issue each year for herbicide applications. You know, herbicides are really, I wouldn't say they're our tool of last resort, but certainly look to hand pulling, smothering, and other strategies for addressing small populations of invasive aquatic vegetation. Unfortunately, sometimes that vegetation can get away from us, and an herbicide treatment becomes important in helping maintain recreational access. We have a pretty strict procedure for considering the scope and scale of any herbicide treatment. It's generally not something we would authorize to be applied lake-wide, and it really is trying to balance the recreational use of our many lakes and ponds with some of the challenges and concerns that Vermonters tend to raise about the use of herbicides. So nothing we enter into lightly, a pretty robust regulatory process, and this is just one of several applications that we anticipate taking place this fall.
Any thoughts on the Cracker Barrel rebrand?
Not really. I've gone to Cracker Barrels before on my visits to my mom in Florida, but I can't think of the last time I was in one. I think that's a corporate decision, and they'll make the decision to do whatever they're going to do based on their customers.
Governor, the top 3 headlines in the Chronicle today, quite by accident, are about Vermont teenage boys, crime, and isolation. UVM reported this week that only 40% of the freshman class are boys or young men, up from 38% the year before. Does Vermont have a success gap between young men and young women? And if so, what are we doing about it?
That's a great question. I don't have the answer to that, and I'm trying to think who might. But we do have issues with young men. I mean, I think that's been not, I don't think that's just recently. I think it's throughout history. Young men need something to do. They're active. They need something to keep their attention. I think our after-school programs are a great example of keeping our kids entertained and doing something instead of going home to an empty home. And Commissioner Smith was instrumental in providing for some of that when over the last few years. And I think it's even more important than ever that we continue with that. That's why sports are important, just to keep kids busy rather than in following other paths that lead to detrimental behavior.
Governor, I wanted to ask, Woodstock native Keegan Bradley, of course, will be going to the Ryder Cup, and he's decided not to play. He's leaving his clubs at home, and he's captaining the team. Did you want to wish him any words of luck?
Yeah, I mean, again, he's had a great career, and we're very proud of what he's done in representing Vermont in the way he has. Again, unfortunate in some respects, but we see that in sports. There's an evolution there. So, but again, I respect his attitude as well as how well he's represented the state.
This week, also, Governor, regulators approved for individuals on health exchange. I think it's almost 10%, nearly 10% increase. the spiraling healthcare story isn't new, but you've now sort of broadcast that your administration is going to look at healthcare costs next session. What can be done here?
Well, again, that's for all of us to contemplate. We need long-term, as I said, we need to keep focusing on our demographics. We need to be a state where people are attracted to the state, and they need housing to do that. They need an affordable climate. We need economic development. We need all of it to attract more people to the state to counter what we've seen over the last decade or two. It's been, consistent that, and I think we'll see it in the next census, that we're not making up any ground here. We're getting older, and we're not backfilling with enough youth, which hurts our workforce. So again, we're going to continue to work on making Vermont more affordable, as well as trying to make it more livable as well. So this is going to be an issue that all of us have to contemplate. We'll need legislative support. I think the Greenmount Care Board is doing a great job with that. Owen Foster, in particular, leading the group, taking some of the stances he has, identifying that we have a gap here that we can't make up. So we're going to have to make some tough decisions. So much like education, healthcare is not any different. Mm-hmm. So we're going to have to take a look to see what we can do. As well, as I mentioned last week, with the federal government coming up with some funding for rural healthcare, we'll have to make applications for that. And it's in a tight time period, so we'll be working on that over the next 2 or 3 months to see if we can bring in the $100 million in grants that will help get us moving in the right direction.
Governor Jim Douglas and former Senator Chris Pearson and a number of business leaders, I'm sure you've seen the group they're working on, I think it's Vermont Healthcare 911 or something to that degree. They're saying that administrative costs at the University of Vermont Health Network are a pretty big piece of this. I'm not hearing any specific proposals or ideas with that or with pharmaceutical. I mean, how much, what can be done, if anything, about that issue? That's something that they've identified.
Again, it's all the above. In trying to contemplate that, we'll need some legislative support, but we also need to engage with the network to see what ideas they may have, because it's, again, much like education, where some of the overhead costs are impacting our ability to pay.
Are there any developments on the return to work initiative at all?
Nothing that we're willing to share at this point. We'll be communicating with state employees directly very soon and outline some of what we're thinking. All right. Thank you all very much. Have a great day.